Hi, everyone. My name is Morgan Harrington, and I am the National Manager of Programs here at American Liver Foundation. I am thrilled to be joined today by Sara Kenimer and Nancy Mason from Massachusetts General Hospital Palliative Care Team. Before we dive in, I wanted to share a little bit about the word palliative. The word palliative is actually derived from the Latin word pallium, which means to cloak or to surround. It's a great reminder about what palliative care really is. It is a way to surround patients and their families with the support that they need, emotionally, physically, or beyond, especially during times of serious illness. Sara Kenimer is a board-certified adult gerontology primary care nurse practitioner. She holds a degree from Connecticut College as well as the University of Pennsylvania and completed a fellowship in interprofessional palliative care at Harvard. Sara works on the inpatient consult service at MGH with a special focus in supporting patients with liver disease through compassionate and goal-centered palliative care. Nancy Mason is a seasoned nurse practitioner with over 40 years experience in nursing, including nearly 2 decades in specialized hospital-based palliative care. She brings deep expertise in her symptom management and communication around serious illness. Since 2021, she has partnered with the transplant hepatology team to advance research on integrating palliative care for patients with advanced liver disease. We're excited to have them here with us today to share their insights and experience. So let's get started.
Hello, thank you for joining us today. My name is Nancy Mason.
And I'm Sara Kenimer.
And we're here to talk to you about palliative care and liver disease. So there is a national organization called the Center to Advance Palliative Care, and they have a definition for palliative care. I'm going to read that definition to you. Palliative care is specialized medical care for people living with a serious illness. This type of care is focused on providing relief from the symptoms and stress of the illness. The goal is to improve quality of life for both the patient and the family. So what is palliative care? Palliative care is, as Morgan had mentioned, it's a word that comes from the Latin word pallium, which means to cloak or surround. We both really love this imagery as it reflects what palliative care aims to do, to wrap support around you as you navigate a serious illness like liver disease. Now, this next point is really important because it's a common source of confusion. Palliative care is not hospice care. One more time, palliative care is not hospice care. Hospice is a type of palliative care for people at the end of life exclusively. But palliative care itself is something broader. It's really about improving quality of life, whether you just received a new diagnosis or you're further along in a disease process.
Great. So palliative care looks at the whole person, not just the illness. We focus on 4 key areas that you can see here that affect your quality of life. The first area is physical. We help to manage symptoms like pain, nausea, fatigue, itching, shortness of breath, really whatever symptom is getting in the way of doing things that you enjoy to do. The next area is emotional. Living with liver disease can be overwhelming. People may feel anxious, depressed, or uncertain about the future. Palliative care provides the space to talk about these feelings. Next is social. Illness can impact your relationships, your ability to work, or even just getting through the day. Palliative care can help support caregivers and connect you to resources that can help you along this journey. And the final key area is spiritual. Having a serious illness can bring up big questions and feelings about life's meaning, faith, and identity. Even asking yourself the question, why is this happening to me? Chaplains and other team members of the palliative care team can help explore these questions with you. So when we say we're here to support you, it is clear here that we mean all of you, not just your liver disease. So we want to take the time to highlight the key players of the palliative care team. As you can see here, it's made up of physicians or advanced practice providers like nurse practitioners, nurses, therapists, volunteers, social work, loss counselors, and spiritual counselors. This is not in replacement of your liver team or other care teams. Palliative care works alongside those teams as an interdisciplinary team to support you and your caregiver. At the center, you will see that there is you, the patient, and the loved one. You are the most important member of the team, and your goals and values help to guide everything that we do. So this is an image that we made that can help think about the role of palliative care in the journey of living with liver disease. So first, let's think of living with liver disease as a river. The path is sometimes calm, it's sometimes unpredictable, and often has a lot of twists and turns. Next, let's look at the boat. You can see that the boat is palliative care. It carries you, your loved ones, and a team of doctors, nurses, social workers, chaplains, and therapists, all working together to help you navigate this journey on the river. Up ahead on the river, you see a bridge. One side is liver transplant, while the other is end-of-life care or hospice. This is to show that wherever your path leads, palliative care stays with you. We are here for the journey with you to help manage your symptoms, support decision-making, and help you live as well as possible every step of the way. You are not in this river alone. So to stay on theme of the river and the palliative care boat, every boat needs oars to keep us in the right direction. Right now, Nancy and I will do a brief role play that demonstrates what a conversation may look like with a clinician introducing you to palliative care. As you listen, we invite you to think about the when, the where, who, what, and how of palliative care. So we'll get started.
Hello, Mrs. Jones. How are you today?
I'm okay. You know, it's been tough. I'm so tired. My belly feels tight, and sometimes my mind just feels foggy. I'm hoping I can just get through this and make it to transplant.
Oh, Mrs. Jones, it sounds really, really hard. I know how much you've been holding and what you're going through. Would it be okay if we talk a bit about your liver disease?
Yeah, I think that would be okay.
Thank you. To make sure I understand, can you please tell me what you know about your liver disease?
Well, I know it's serious, and I know my liver is pretty sick. I've been in the hospital a few times this past year, but I'm really hoping I can make it to transplant and make that list.
You have been dealing with a lot, including that fluid building up, so your belly feels tight and hurts a little bit, and sometimes you get a little mixed up or foggy and confused. And you are in the process of being worked up for a liver transplant. So right now, please help me know what's most important to you, what's on your mind.
Well, I really want to feel well. And like I said, I'm holding on to hope that I can get a new liver.
I'm holding on to that hope too with you, Mrs. Jones. What are some things that you're really worried about?
Well, I worry that I won't be listed, or even if I am listed, what if I'm not strong enough for transplant? I'm really scared. I worry I'll just keep getting weaker and sicker and end up right back here in the hospital again.
I worry too. And I really wish we didn't have to worry about this.
Me too.
We will figure this out together. I was wondering, have you ever heard of palliative care?
Palliative care? Isn't that for people at the end of life?
That's a very common misconception. Palliative care is about helping people live as well as they can for as long as they can with a serious illness. Palliative care helps to manage symptoms, supports you, and helps you and your family understand liver disease and plan ahead. The palliative care team is made up of doctors, nurses, social workers, and chaplains, and it's an extra layer of support that works with you and your medical team.
So it's not giving up?
No, it is not giving up at all. It's an extra team that helps with symptom management. For example, how you've been feeling uncomfortable and a lot of feeling tired and fatigued.
Yeah.
And it even checks in, on how you're doing in life. How's your quality of life? How's your family? And what's most important to you? They can also support your caregivers.
That sounds incredibly helpful. I had no idea I could get this kind of help right now.
Absolutely. I want to make sure you are feeling as well as possible, no matter where you are in your treatment journey. Palliative care will be part of your team when you are in the hospital and sometimes even in clinic or at home, depending on what's available where you live and what you need.
Thank you. Let's take this one step at a time.
That's right. Together, we'll take it one step at a time. Thank you so much, Mrs. Jones, for having this conversation today. I know this is really important stuff, and sometimes it's very difficult to talk about. I want to be sure you have all the support you need.
Thank you.
So, as we close, let's review the basics of palliative care that we learned today. Palliative care can be part of your care team anytime in your illness. It does not need to wait until you are really sick. In fact, we know that getting support from palliative care early can make a really big difference.
Palliative care can be provided in the hospital, outpatient clinics, or your home. This is dependent on where you live and where you get your care. Most times, patients unfortunately meet the palliative care for the first time when they are in the hospital. If home-based palliative care is available, this can be provided alongside the home care you already may have in your home with nurses, physical therapists, occupational therapists, etc.
Palliative care is a team of doctors, nurses, social workers, and chaplains. You and your loved one is always in the center.
Palliative care focuses on managing symptoms, supporting decision-making, and improving quality of life. We bring an extra layer of support to help you live as well as possible for as long as possible.
We partner with your existing medical and liver teams and do not replace them. If interested in getting palliative care involved in your care, please talk to your provider to see if these services are available. Palliative care is here to help make the journey a little bit easier. I'm Nancy.
And I'm Sara.
Thanks for listening and learning about liver disease and palliative care.
Thank you so much for that incredible information, Nancy and Sara. I really appreciate you guys taking time to even demonstrate with the role play. I think that that is incredibly beneficial to so many patients and caregivers to really have that relatable experience when we're talking about a topic that is widely unknown and misunderstood. I did have a few questions, though, that role play did bring up. And one of those is palliative care covered by insurance?
That's a really good question. Yes, palliative care is covered by insurance. So as I had mentioned, it's a subspecialty of medicine. And to give an example of other subspecialty of medicines is like if you had a heart condition and you needed to see a cardiologist, that's a subspecialty of medicine. Or a really bad infection and you needed to see an infectious disease doctor. So if you have a serious illness and you need to see a palliative care provider, that you just ask for it. And we're covered under insurance, just like any other subspecialty of medicine.
That's great to know. I think that will provide a lot of relief to people as well to know that this isn't something that's considered out-of-pocket expense. And you also mentioned a little bit about caregiver support. I'm curious what kind of support is provided for caregivers?
Yeah, as we talked about, the patient and a caregiver is the center of what we do in palliative care. Of course, the patient's wishes is really important to us, but really supporting the caregiver as well. And what we do as palliative care providers through our experience is that we are able to spend really good quality time with caregivers as well to hear their experience of living with someone who is living with a serious illness, whether that's joint conversations that are had with the patient and the caregiver together, or able to talk to the caregiver one-on-one to hear about their experience. And I think one of the really good things that we do is just able to sit in the uncertainty with caregivers and offer them support and connect them to resources that may be helpful for them for specific things that they may be needing, and connecting them with a social worker, of course, if that's what they need. And I think really leaning on our interdisciplinary team members for that is really important.
So true.
The second thing I wanted to bring up is when patients experience hepatic encephalopathy or a little bit or confusion and are unable to make their wishes known to a provider like us. I think that's when we really lean on caregivers. And I wanted to plug the importance of a healthcare proxy form, and patients and caregivers talking about what's most important to them if they were to get really sick, so that caregivers are able to advocate for them when the patient is unable to make their needs or wishes known. So I think and palliative care can definitely help with that process as well, talking through that and helping name a healthcare proxy.
Oh, that's great. That is some wonderful information to share, especially about the importance of having that healthcare proxy, like you mentioned. Another thing that came up was you mentioned that you could do palliative care at any time in an illness. Obviously, there have to be some parameters that are there, but what does that really mean when you say any time within an illness, you are sort of eligible for palliative care?
That's a great question too. Thank you. So it is any time in a serious illness. So palliative care originally started in the oncology world, and we have expanded to all kinds of, if you will, chronic progressive diseases like liver disease. So some people may have some abnormalities in their liver that, are treatable and not really serious. But if it does become serious, if people are having a lot of symptoms, or if their team is talking about, I'm really worried that we might be thinking about a liver transplant, or you're getting sicker, that would be the time to really inquire about palliative care and to see, if it's available and if they can be part of their team.
That makes sense. I really appreciate you just clarifying a little bit more on that. And then my last question before we wrap up is, how can patients or caregivers really advocate for palliative care if it isn't something that's presented to them initially?
Yeah, I think, like we said and tried to focus on in our presentation, is really asking and talking to their provider about palliative care, maybe referencing that they learned about palliative care through the American Liver Foundation and think that it's a really good resource for them. It really is dependent on the resources that are available in the state you're in the hospital setting you're in. So what we really want you to know is just to ask to see if it is available for you. And your liver doctor may need some education around palliative care too, and how that's important. And so taking what you learned and really advocating and maybe listing the things that we talked about, like, I really think I need help with some symptom management, or, you know what, my days, I'm really tired and I'm not able to get out and garden, for example, and do the things I really like to do. Do you think palliative care would be a good team for me to help talk about these things and talk about what's most important? So I think approaching it with curiosity and really just seeing if that's available, I think that's our best advice.
Yeah, that's great advice, especially being able to be armed with a little bit of knowledge when you go in and just have a little bit of that background information to support yourself as well. Well, I cannot thank you both enough today for being here with us and sharing such important information. And we are so grateful for you guys taking this time with us today. And we really look forward to being able to meet again sometime.
Yeah, of course. Thank you.
Yeah, thanks for having us.
Thank you.